Another important hip function is external rotation. Now, if you're lacking in external rotation, the result is still damage to the facet joints in the back, in the low back. It's still knee pain and damage from using them in an imbalanced way. It's still SI joint dysfunction, because if you don't have external rotation, you're still moving your whole pelvis to get that movement. That movement is important for walking, especially for stable squatting. So external rotation is important so that you aren't paying the price with your low back, with your knees, with your pelvis. So there's a couple tests that you can do that are super easy to make sure that you have that range of motion. So let's go through a few. If you are sitting on a bench or a chair, you take your femur and externally rotate it so that the knee will be pointing out, and you're going to pull your foot in. Now, I have not developed good external rotation because when I had my last baby, I had a really bad separation in the front of the pelvis in the pubis symphysis. So I worked for a decade to really strengthen my internal rotation and really secure those tendons and muscles to hold the damaged cartilage in place. However, that being said, it's still really critical to have sufficient external rotation. So that's where I need to spend time next. So if you just take your femur, rotates this way, your foot comes in. In an ideal world, you would have 60 degrees. I don't. That's something I have to work on. And then of course, test both sides. You'll find that one is different than the other. Another way is if you lay face down. If you lay face down and bring your knee up, just do one at a time, and allow the femur to move out and the foot to come in, and just test how that feels, what feels tight. Ideally, you would have about 50 degrees here. And then test both sides. You will find that one is more mobile than the other. And that will just give you an idea of where you're at. You can also come up into a 90-90 position and pay attention to how close that knee is to the floor. Are you able to sit up and get that knee relatively close to the floor? And then of course, test both sides. There will most always be a difference. So I have a little bit better external rotation in my right leg than in my left. So that's something that I'm going to work on. Now, it's important to have that external rotation. If you don't, that means that all of your psoas, your TFL, all of the internal rotators are super strong, and then you're going to have weaker external rotators. The piriformis, all of those fan muscles at the back of the pelvis that pull the femur back into external rotation will be weak. So let's talk about some ways that you can strengthen those, and then also help to release the muscles that are really holding on too tight.